Hi everybody, welcome back to Charted TV. I hope 2018 is treating you just lovely. I thought I'd just make a video kind of giving an update on my nursing career. I know I've been posting a lot of vlogs and stuff, but I just wanted to kind of like tell you guys about my job and what I've been doing and things that I think can be helpful to you as you like embark on your career, or if you're starting your career, and things to kind of be aware of as you start to like gain more knowledge as a nurse, gain more critical thinking skills, and just start to kind of like find your way in your career as a nurse. So I have been a nurse for almost 8 months now, which seems very surreal. I feel like I was just in nursing school, just preparing to take my NCLEX, and now 8 months later I'm a whole nurse, like doing everything that a nurse does, which is like it's like a whirlwind to think about how fast life is. So now that it is February 2018, I have been off orientation since the first week in December. So I'm officially taking patients on my own. I'm currently working night shift now, which I love, and which I would recommend for all brand new nurses, because night shift it's work. It's still work. Don't get it confused. Like, we still do so much during the night shift, but it's just sometimes it's like a slower pace to kind of help you get acclimated to certain things, so you don't have doctors putting in orders every like 20 to 30 minutes, calling consults. You don't have a lot of family there, like, to kind of like educate on everything that you're doing during the day. I mean, sometimes you do have family who stay over, but most of the time it's a little more relaxed at nighttime, so you get to actually think about what you're doing instead of like, okay, the doctor ordered LASIK, so I'm going to give LASIK because blah, blah, blah. You can think throughout the pathophysiology and why are you really doing this, instead of just like following the orders that the doctor put in just because the doctor said so. Like, it helps you kind of gain your own nursing judgment, because sometimes you'll see an order and you'll think like, I don't think this is right. Or like, for example, like I work on a post-cardiac surgical floor, so a lot of times like you'll have orders for like metoprolol and the patient will still be on the pressor, so you have to like know like, okay, why would I give a blood pressure medication when I'm giving them when they're on a vasoactive drug to increase their blood pressure? So it just like helps you think throughout the whole process instead of actually like just giving meds because they're on your MAR, or doing this because somebody else told you to do it. So it kind of helps you to just gain your own sense of judgment. And so I'm just gonna break down like kind of like how my night goes, or exactly what we do in the CVICU. So CVICU stands for cardiovascular intensive care unit. So what most likely happens is a patient will go through pre-op on another floor, pack you on another floor, and then as soon as they are out of surgery, they come up to the CVICU. They'll be on the vent, most of them still intubated. They will have several different drips running, any like lingering blood that they're still pushing through, like after the procedure has wrapped up, will be going. So they'll come up to our floor and they'll have all this stuff going, and our job is to see them through recovery after they have any kind of open heart procedure, thoracic procedure, vascular procedures, anything of that nature. That's what I take care of every day I go to work, which is very exciting, is because I really love like anything heart related, because I feel like, okay, all of your organs are important, but like the heart is like what keeps you going. Your heart is perfusing blood throughout the rest of your body, so when your heart isn't working right, the rest of your body isn't working right. So I think it's so cool to see how like patients will come to the hospital with all these symptoms, and like they figure out it's a heart problem or a pump problem, and they get it fixed, and you'll kind of see the full recovery of the patient. And I think that's so intriguing to me. So that's pretty much like what kind of patient population I take care of. Another thing you kind of have to get used to as a new nurse is your time management. No matter what kind of unit you work on, time management is super important. So I think that's also a good thing about working night shift. But I said all that to say, the most important part of the night is like when you first get to work and you get reporting your patients and you plan out your night. You figure out everything that you need to do, all the goals you need to accomplish by the end of your shift, and from that you kind of like keep the night going by just checking off stuff off your task list. One thing about working in ICU is like the stability of the patients is sometimes up in the air. So like you'll have a set task list and then something else happens and you'll have to kind of like rearrange it. So you'll spend a lot of time rearranging your task list, but it's really important at the beginning of your shift when you get report to be fully alert, fully engaged, and fully ready to work, because how you set up your night is how your night is going to go. So if you get a not good report and you actually don't take the time to go look through the chart and actually see what's going on, then it's just like you'll be looking like SpongeBob, no, Mr. Krabs. It's like, so it's kind of important to just, you know, start your night off right. So how I usually do it is I get a report, I come to work, my shift technically starts at 7, it's from 7 to 7, but I usually get to work like at 7:38, clock in, we go into the break room, you drink your coffee, whatever, anything to keep you alert and oriented. And the charge nurse, the A&M, will come in and kind of do a huddle, go over some things that are important, check your email, do this, do that, and then they'll kind of give everybody their assignment. On a typical night, will either get between 2 to 3 patients. I'll get 2 patients if they're both ICU, or I have 3 patients if they're all tele. And tele basically means they are downgraded level of care, so they don't require as much as the ICU patient. So it kind of rotates, like everybody gets tripled based on like a rotation. So like if you got triple one night, you're not gonna get triple the night before. So yeah, you have 2 patients, and don't let 2 patients sound like a piece of cake, because the amount of stuff that you have to do for 2 patients on an ICU unit is not the same that you have to do for patients on any other floor. So you get a report, you get a report from the charge nurse, go out onto the floor, get a report from your colleagues who work day shift, and that's also very important. Who has your patients before you can also depend on the level of work that you have to do overnight. A lot of times we don't get the same patients back because it's a surgical unit. Some patients get transferred to a progressive care unit, and then some patients are so heavy that they like to rotate them amongst other nurses. So that's pretty much the beginning of the shift. So you get a report on your patients, you start to look through your chart, see all the meds you have to do, see the labs, look at the progress notes from the doctor, kind of see what the plan is with that specific patient, and then you kind of get your night started off there. So charting is super important, but it's also one of the parts of nursing that is kind of like monotonous and tedious. Being in ICU, we have strict things we have to chart on. So we have to do a 8, 12, and 4 o'clock assessment, full assessment, neuro, everything, head to toe. You chart on that, and every 2 hours you do safety, activity, pain. If you have a central line in and you have things infusing through it, you chart on that every 2 hours. If you have a peripheral IV in, you chart on that every 2 hours, and it's running, it's infusing, you chart on that every 2 hours. Vitals we do every hour. And what else? If they have any like drains, so like a chest tube, you chart on the output every hour. If they have Foley, you chart on the output every hour. All that good stuff, you chart on that. And if they're on an insulin drip. So one thing I will say about working in such a specific unit is you kind of get accustomed to a certain patient population. So okay, so another thing, a lot of people choose to go into nursing field for various reasons, scheduling being one of them. So the fact that nurses who work on the floor, the staff nurse, can work 12-hour shifts 3 days a week, and that's considered full-time. A lot of people think that's like an upside to it. which it is. Like, I love working 3 days a week. Where sometimes there is a bit of discrepancy is in the fact that how you schedule yourself. That's really important too. So when I first got off orientation, I was like, I want to work all 3 of my days back to back so I can have a lot of days off at a time, and then I can go take trips and do all this stuff because I'm young and that's what I want to do. Which, it sounded good. It really did. It really did. Working 3 days a week in a row sounds great. Sounds like a great plan. But when you like actually get to work and you're on your 3rd day and you're just like, I am mentally and physically drained, I just want to go home and sleep for the next 4 days, is where it becomes an issue. You kind of like experience a little bit of burnout. So what I have been trying to do is trying to figure out what days, like scheduling myself, which days work best for me. So what I have learned is that weekends are not as busy on my unit because we're surgical, so mostly during the week is where we get all our surgeries. If there's an emergency on the weekend, of course we'll have emergency surgery, but 9 times out of 10 weekends are a little more relaxed. So I figured if I work 3 days in a row on the weekend, then it's a little less taxing on my body than working 3 days in a row during the week. And then I decided, like, when I work on the weekdays, I'll just do like 2 days on, 2 days off, and then finish up with my 1 day, which is still isn't bad. Like, it's really actually a good thing. So that's pretty much how I've been scheduling myself. So that's another thing as a new nurse. You just have to learn like what kind of schedule works for you. Some people can push out 3 days in a row. Some people do it effortlessly. Some people can just pick up shifts, work 5 days in a row. I am not there yet. Like, I'm trying to, because of course I want to work extra and make more money, but like I just have to build myself up to do it, because I literally am so tired when I get off work. So yeah, that's something else you have to take into consideration. Another thing I would say is, like, as a new nurse, you like feel like so accomplished. Like, I went through nursing school, I studied all the information, I learned all that stuff, and now I can just keep my feet up and just go to work and come home and not have to worry about reading, studying, learning new things. That's a lie. That is a complete lie. So being a nurse is a lifetime of learning, because there's always new research being found, new evidence-based practice, new things they are implementing in the world of nursing and healthcare and medicine, and you're always learning. Like, literally, there's always something new to learn. You don't know, you don't know everything. So that's one thing I'm working on, is trying to balance my time where I can read research and new literature outside of work. Even just brushing up on your pathophysiology so you know why you're doing what you're doing, and kind of helping to advance those critical thinking skills. So I would strongly encourage all nurses to just continue learning, never just say, okay, this is it, I'm going to just go to work. One, you can't do that because you have to do continuing education, and every hospital has certain things they have to complete. But just outside of all that, still learn and study and do everything you can do to provide your patients with the best care, because in the long run they'll be thankful for it and you'll be a great nurse and everybody will sing your praises. So yeah, that's another thing that I'm learning. From working in ICU, we deal with a lot of different types of equipment. So right now I'm in the process of taking certain classes, certain certifications where I'm able to work a CRT machine, work an impella balloon, an impella or a aortic balloon pump, or just different types of things, learning about hypothermia treatment, just all types of anything that you can learn and you find it interesting and it's related to what you do. I would say take advantage and just learn, and then use it to, you can actually like see how it's affecting your clinical practice, like right then and there. And I think that's a really good thing. And another thing is, like, when doctors hold forums on what's really important, because surgeons, like, they sometimes change their protocol, their orders, their order sets, and like what they want you to do. So when they hold open forums and stuff to discuss like different things they're implementing in their surgeries and different things they want their patient on after surgery, attend those things so you'll be abreast to all the new knowledge they have to share. Surgeons are wonderful minds. They are surgeons, doctors, nurses, anybody. Everybody has a great mind. Like, if they put, you know, if they're putting out information, take advantage of it and soak it all in and just grow and be a smart nurse. It's nothing more great than being a smart nurse. Like, you want to be a smart nurse. So yeah, those are just some things that I have learned and I have kind of like realized as a nurse 8 months into my career. I still love my job. I'm really in the process of just trying to figure out, you know, what other parts of nursing I'm interested in, just to like kind of get that experience and see other ways I can, you know, make a couple dollars. But yeah, I really love what I do. I really love the unit I'm on. I think it's a really great unit for learning, and as far as like you being pushed to always be current in your knowledge. So yeah, I hope everybody enjoyed this video. It's been such a great pleasure to share my experiences with you. If you have any questions, comments, concerns, if you need advice, if you have ideas for future videos you want me to do, just let me know, and I look forward to seeing you guys in my next video.